me that they were going to do donations to the Oracle program, and at that point we weren't really set up for that. Although I did appreciate that. That's not our role, is to get them help, and so that is a story that kind of sticks with me because I remember the pain that she had, and at the same time how appreciative she was of what law enforcement is doing and how we're changing to help people. And I know these guys got a lot more stories than that, but that's one story that I had that I went personally to. And I get phone calls all the time, and whether it's people in government, because we have people in government. This epidemic hits everyone. Doesn't matter if you're rich, poor, and so yes, there was one point we even got a phone call from a county on a bordering county on a county worker that we had to go and help. So there's a lot of stories out there, but these guys that go out there every single day, they get them food, they get them housing, they'll drive them to the airport, they'll drive them to rehab, and the stories that they have are a lot more than in detail. I'm sure they're shy, they don't want to talk about it. You don't have to say names or anything, but you can definitely say what you've seen and how you change somebody's life, because that's really what this is about.
I can certainly give a little brief overview of total team effort, and me as the guy that oversees this program and all these wonderful people under me, watching them work, and Julianah on the phone with a doctor and a social worker, basically telling them like, hey, listen, this person is in a very bad way, and there's medical issues, and there's housing issues, and there's insurance issues and transportation issues. And, it was an all-day event that, really ended at 2:00 in the morning with Jess and another member picking this individual up and driving them to a crisis center. And to me, that was amazing. And as a supervisor that is overseeing all this, I was just totally amazed at the conversations that were going on. And just the team effort in the room that day was something to be proud of. So that's one quick one. And Julianah can elaborate a little bit more on that one, because I'm sure she knows exactly what I'm talking about. And the other one is we were helping this individual in crisis, and they were in the hospital, and I actually had a doctor asked to speak to me. And the doctor says, hey, we're willing to assist you guys and help you out with this individual, and keep the person here in the hospital overnight, which is almost unheard of anymore, as long as you tell me that you have a plan in place for this individual in the morning. And I said, Doc, I absolutely have a plan in place. This team will do whatever it takes to get this person to where they need to be. And he said, great, that's all I needed to hear from you. Thank you so much. And then lo and behold, I get a phone call 5 minutes later from the doctor going, hey, do you think this place that you're going with this individual is going to want blood work and lab results? I'm like, sure, Doc, sounds good to me. And he's like, all right, thanks. And so that was two pretty awesome stories. That was a total team effort, and certainly something to be proud of.
Thank you, Chad.
Thank you. I just wanted to add to that story that Chad mentioned, and I'm sure Jess can remember this story as well. It was a young lady that reached out to us. Actually, the referral came from the Ulster County Department of Health. They said this lady just called their office. She needed help. This lady had been on an incredible amount of pain medication from the age of 13. Suddenly the primary care provider that was providing the medication closed. The provider's office closed down. This lady she's been on this medication for like 20 something years. So that's the same story Chad was talking about. So we reached out to her. We had to wait. We sat down as a team, myself, Chad, the police officers, Jessica. We said, what can we do? So we had to wait till 10 p.m. to actually go to her house. She's in Lake Katrine. We went there, we transported her. I collaborated with Dutchess County Department, the Stabilization Center in Dutchess County. I called the medical director of Mid-Hudson Regional Hospital, the Turning Point, myself, because she also has other medical issues. She's a type 1 diabetes, and she has other issues going on in her life. It was a real bad case. So Dr. Tui just told me, bring her in that morning, So we took her there to the hospital. She slept over at the stabilization center. Jess and the detective was there with her. They took her to the hospital. She was in the hospital 5:45 a.m. They had her in. She was really in a lot of distress. But she was in the hospital for like a month. She came back and I spoke to her this week. And she said to me, Julianah, you guys just saved my life. She's back at home with her family. She's on methadone at Bridgeback. She is doing outpatient. And then we also set up an appointment with our pain management doctor. But it's just amazing. Just that one story can make us go on and on. And like Lieutenant Chad said, we do work as a team. And that teamwork is the most important part of it all. Thank you.
Thank you, Julianah. How about you, Juanita? When you seem to smile a little bit when I asked for stories. How about
because
you?
there's so many. So, my involvement, obviously I work in a very different department, in a different building, but very connected to this team. And so, a recent event came to mind. It was actually an interagency collaboration, is watching this team work together and then also see how they work with other organizations. It was pretty special. So there was an organization that referred someone who was experiencing chronic homelessness and also opioid use disorder. It was pretty much 5 o'clock on the dot when this referral came in. So the team was just about to go home, but of course they didn't. And so this referral came to Julianah at the time, and this individual was in Ellenville and didn't have a ride and wasn't going to be able to get into treatment until Monday. So it was like a Friday, and needed a place to stay for the weekend until they were able to get him into treatment. And so through one of our interventions through the Healing Community Study, is we do offer hotel vouchers to kind of bridge that gap between when a person decides they want to go into treatment to until they are able to actually go, which is usually only one or just a few days. And so I received a call from Julianah because the issue was transportation. And so the issue was, okay, so can we use a voucher? So, I was able to help authorize the use of the voucher, and then also work with the team to identify possibilities for transportation. Julianah was calling me that night. I think we were on the phone until about 8 o'clock, on and off, texting back and forth, trying to secure transportation. And through collaborative work, so working together as a team, but also reaching out and leveraging the resources from the other organizations in the community, Julianah was able to work with another peer organization to provide transportation for this individual to get to the hotel. And on Monday morning, I always want to check in and get, find out what the outcomes were. I was told that this person made it successfully to treatment and is currently in treatment. So it was this team group effort, but it wasn't just our team. It was, really, it was a collaboration and team effort with other organizations that were also partnered with. So I don't know if I said that, if you guys want to add anything, but it just really showed the dedication, I think, that this team has, not only to the individual, but also to the community.
That is clear. Thank you, Juanita. Juan, are these folks getting overtime pay? I won't get into the union issues.
So Chad is the supervisor. We do obviously if we do have overtime, but we also have comp time. So we try to. I don't check the clocks. I know they work 7 days a week, and they do. They get referrals from the hotline that we put up. They also get referrals from family members because the word's out about Oracle. And at the end of this, we're going to put out a pamphlet that was done by the Oracle team that has an email, phone number that people can reach out. We're also in November going to roll out with the Sheriff's app, and in the Sheriff's app, there's going to be a whole lot of information on it. But one of the things that's going to be on there is going to be icon for Oracle, which means anybody can submit fill out a form to get somebody help if they want someone to go to rehab, or if they have a family member that they want us to go talk to, and that's a big thing. I'm really happy about that. We're going to roll that out in November. But referrals are coming, not just like Jessica said, at these events that we go to. The hospitals call us, local police departments call us. Local police departments now submit a form to Oracle when they go to an overdose. And we usually go, and I say 24 hours, but these guys are getting there with 8 hours. That's how quick they're reacting to them. I've heard, 1 week it was like 47 places that they had to go to. I mean, they're pretty busy, and my hat's off to them. And yes, I don't want them to get burnt out. And Chad's got a pretty good handle on trying to give the folks the time off that they need. And we are definitely striving to do that.
Okay, well, it's clear you all work together as a team and lean on each other and get strength from each other. Your story seemed to produce a whole string of questions here now in chat. So let's get to those questions from our listeners here. This one, and may I just repeat that if you are going to add a question to chat, if you want to, you can direct it to any one of the 5 individuals. Lucas asks a question here, not directed to anyone in particular, but maybe Juan or Juanita might be in a good position to ask. Are there any plans to bring back the Community Corrections Program, CCP, which was formerly located at the old jail campus, or the Chemical Dependency Day Treatment Program, CDD-TP, formerly at Golden Hill? If not, what new programs will be introduced that approximate that level of care and support?
I think, Lucas, you're hearing what we're doing in support of changing the way we in corrections and law enforcement deal with folks that have this disease, because that's really what it is. It's a disease. And that's what we are training law enforcement to understand. I said earlier, it was $262 a day, but to put somebody in the jail, and we can use that money a little bit more smartly if we get them to rehab. And that's what our main goal is nowadays. Used to be once upon a time that if somebody overdoses, they wouldn't even call 911 because they were afraid they were going to get arrested. Well, that's not the case anymore. Our job is to get people the help so they don't come into our correctional facility. As far as the chemical dependency day, the program that Oracle is in itself is a tremendously new program. For the first time in history in this county and in the Hudson Valley, we have social workers and peer advocates that work with law enforcement, work for the sheriff. And not just me, the sheriff or the sheriff's office, but Saugerties PD, Kingston Police Department, New Paltz Police Department. They could pick up the phone and speak to anyone on the screen here, and they're going to get the help that they want. That, to me, in itself is a culture change that I think is better than what was that we're looking at in the past. Now, I'm not, for the record, real familiar with either one of those programs. What I can tell you is that what we're doing here is trailblazing and new, and I think it's better than probably what we had in the past.
Okay, Juanita.
Question.
Juanita, do you have anything to add to that?
No, I mean, I think that I think the sheriff is correct. The O.R.A.C.L.E program is definitely a new program, and it is responding to the community in terms of reentry. Something that the sheriff mentioned a little bit earlier was that they are going to be introducing a MAT program at the jail. It's not just a program; it will be a fully functioning substance use. It's not just MAT. It will be a fully functioning substance use program with groups, with counseling, with just so many opportunities, and it also will include a discharge and reentry component, which will marry very well with this team that we have here. So when a person is discharged, upon discharge, they will be connected with a peer. It's no longer that, cold handoff, it's warm, it's hot. So they will be connected with someone actually even before they leave the jail, and that person will stay with them upon reentry and assist them in connecting with housing, connecting with employment, and just any other linkages that they need to make upon release. And the MAP program itself, I do want to just say that we understand that prisoners and jail inmates released into the community are about 40 times more likely to die of an opioid overdose than the general population. So even if, even if they, at the very least, just had medication and specialized discharge planning, there's so much evidence to say that MAT is proven to reduce opioid deaths by 40%. So initiating this program alone is going to have such a great impact on our most vulnerable residents, our most vulnerable population. And I just want to put that out there. So this is new, and this is going to be extremely impactful, implementing this new programming in the jail.
And I wanted to add something that she just said that's extremely important, and that is discharge planning and reentry, two completely different things. And that now is going to be connected. And what we want to do is follow people out so they don't fall through the cracks and come back to the jail. And that warm handoff to somebody before they walk out the jail is extremely important. And how many times have we heard the story when someone gets discharged from the facility and 2 days later they died of an overdose because they still thought they had the same tolerance level that they had when they came in? So that's what we're looking to do. The pandemic has slowed down that progress, but we are back on board now. We're moving this forward, and it's going to happen, and it's going to happen real soon. Less than 30 days to that second part of focusing on reentry. And of course, I know Eve Walter, who's the chair of the Law Enforcement Committee, also has a resolution where we're going to team up, and we have so many team members. Which, guys, you got to talk about our team members, like Ellenville Hospital and Family of Woodstock. Housing has always been a big issue here in Ulster County. It continues to be a big issue because we know when folks go back to the same place, they're going to have triggers, and they may go back to their addiction, and we know that. So we're focusing on figuring out how we can change that, and that's what this program is all about. And we continue to evolve, and we actually ask the public if you have a great idea that we can use that can help us, because this is fluid, this is new, we've never done this before. So obviously, if there's some experts out there, we're definitely going to listen to you and see if we can add to what we're already doing.
Okay, thank you. Well, here's a question that maybe, I don't know, Julianah, Jessica might deal with in the day-to-day work. It has to do with housing, affordable housing. Have you had challenges in getting people into inpatient rehab, as well as helping folks after rehab to find affordable housing, which we know is a tremendous problem in our county?
Thank you for that question. That's a very important question. When somebody is going into withdrawal, the first point of care is a detox, the medical detoxification program. The challenge we have, like I said earlier, is that we don't have a detox in Ulster County, so we have to look around. We will travel anywhere to find help. We'll go to Albany, we'll go to Pennsylvania, we'll go to any state that insurance can be taken. Anywhere we will find that help for that person. From that, when the person gets into a detox, we already started tracking that person. We're going to have collaboration with the facility to make sure that the person they are involved in the discharge planning. If the person is going to be discharged and we know safety or homelessness is the problem, we're already working towards that goal. Like I have an individual that just called me today. I'm discharging on Tuesday. We involve the collaborations that we have. Good enough, we have the Ulster County Department of Health. We have the SPOA, which is now very, we do a lot of collaborations with them. Ulster County Department of Social Services, we have direct access. We have direct access to other services, and we're able to find temporary housing for this person. We're not going to leave that person. We're now going to fill up an individual SPOA application for an adult or application for that person, we're still going to be following up to make sure this person, have a stable and a more permanent housing. We don't give up. We're following them up. If they struggle, they call us. We're still finding help for them. So it's a lot of challenges getting detox in Ulster County. I think Jess would add something to that.
Yeah, I mean, just to go along with what Julianah said, I mean, one of our biggest struggles is the lack of beds available, and time is critical. When a person is ready to go to detox, that's a very small window that you have. Like she said, so just to kind of tie a couple things together, the sheriff was talking about how we have collaboration with other police departments, and we'll, like Julianah said, we'll go anywhere. I took a trip with one of the police officers from Saugerties Police Department up to Binghamton, 3.5 hours away, to drive someone to detox because we couldn't find anywhere around here that had a bed, and we needed to go that minute. So we were on the phone on the way up there doing the admission intake assessment with that person in the back seat, driving them to Binghamton. I mean, whatever it takes to get that person help when they're ready. But that is a huge struggle, is the lack of beds, because time is critical. And yeah, housing, I mean, transitioning home, whether it be from the jail or from treatment, the healing communities vouchers, the housing vouchers, those have been amazing, but that provides a small bridge to people coming home for a couple days or people going in for a couple days. If that's not a long-term fix, unfortunately, and that's something that, we do struggle with is finding affordable housing.
Along with many, many others in Ulster County. Indeed. Here's the question that actually connects with what you were talking about with detox centers. This is from Joel. Has there been a proposal to secure funding for a detox center in Ulster from the monies awarded to the county through the COVID-19 stimulus package, which amounted to about 34 million in Ulster County?
Juanita, you want to hit that one?
Yeah, so I was also peeking into the chat, and we have Vincent Martello from the health department mentioned. So we had a behavioral health task force that I had, the fortunate opportunity to sit on. And so what this task force really did was it did a bit of a gap analysis in terms of what programs do we have, what programs do we need? And of course, detox came right up top of the list, one of the first things mentioned. So increasing our methadone slots and of course, establishing detox beds in our county it's a huge priority. So our behavioral health task force did issue a report, and so if you want to send us your email address, or we can share that report, it is posted on the Ulster County site, but it is talking about the different projects that will be included in our county's behavioral health plan, and of course, this was one of them. So RFPs have not been issued yet, of course, but this is something that is a huge priority for all of us.
And I know that there's also other monies that are coming to the county in regards to the settlement from the opioid companies that the Attorney General's office has given us. And I know that the county executive, Pat Ryan, is along with the legislatures working to put a stabilization center for both mental health and substance abuse here in Ulster County and expanding that. So they are talking about that. They are looking at that. That is something that's going to happen here pretty soon. And I know that the county executive is working on that with his staff. And I think we're all excited about that because we do need a lot of help in this county. It doesn't help when our hospital sends beds to Poughkeepsie and we have to go outside the county to get someone into rehab. All I can say is that we are working on it, and because we have to do something better because what we have now is not sufficient.
Okay.
Tom, if I could jump in for just a second. There was also a question from Amy about whether any thoughts been given to using the unused parts of the jail for detox.
What was that question? I'm sorry.
Any thought to using unused part of the parts of the jail for detox.
The only way someone, because of the way the law is, and we have what's called a direct supervision jail. So it's not segregated, separated. There's only one way in, one way out. And by law, there's only one way to get into the jail, and that's by a court order. And until that happens, there's not much that we can do as far as using the facility for detox. We do have a separate pod and that's a housing unit that we're using for the MAP program right now. And so when we expand this, and if you, obviously it's because you committed a crime that you're coming into the facility. And if that's the case, then yes, we do have a separate housing unit that's going to be housing folks. And we're going to expand that starting November 7th. And we're going to open it up to folks. There'll be a screening. There'll be obviously blood testing and counseling that comes along with that before you get placed into the program. The program itself, there's going to be a contract that's going to be signed by that individual and the medical, prime care vendor to make sure that they're within the guidelines of that contract. As far as bringing outsiders in, the only way into the jail is by court order, and that's a state law.
Okay. All right. I'm going to try to move us along here. We have about 20 minutes left and still quite a few questions. This is a rhetorical question, but you deserve it. To all the team, do your wings encumber you when you try to sleep because you're all angels? Well, no answer really to that, but indeed you are. Liz asks, how does the Urgent Center Mental Health Center in Kingston fit with Oracle? The Urgent Center Mental Health Center.
So I know we are working with mobile mental health. I have a meeting next week, actually 2 weeks, with the county executive on deferring phone calls that we get to the sheriff's office, to the 911 center to get, if it's a mental health call, to get the mental health mobile mental health team out there. This is, again, we are just under 2 years old. And again, we'll reach out. And one thing we didn't say is the expertise that we have here. Julianah, you didn't say what your expertise is, not only for substance abuse, but also for mental health. Because we know that there's always an underlying issue why the person becomes addicted to begin with. And we realize that and know that. The other thing about the team, it's not just for opioids. It's not just for opioids. It's for any substance abuse. Obviously, we're focusing on opioid because there's an epidemic, but it's for any substance abuse.
Okay, look, I'm going to group these two questions together because there is a connection. Lisa asks, will there be more methadone clinics opening in Ulster County at some point? But Lucas also asks, is the MAT program going to steer clients toward Suboxone rather than methadone?
That's a great question. I'll answer that last part because we just had a meeting about this. That's why Juanita's laughing. Methadone's tough to get in Ulster County. So yes, Suboxone is the primary medicine that we're going to use. And I'm going to let Juanita answer the question on the methadone clinics because we know the issues that we have here in the county about methadone clinics.
So yes, I'm going to actually share the task force report with everyone. We do talk a little bit in the report about some of the wait lists. So we do have a wait list in our county for methadone. There is new legislation that has been enacted by our governor, which is going to mandate that, jails, we're obviously ahead of the game here because we've been planning this for quite a while. The sheriff's been, really laying out this plan. I think Sheriff, it's been a few years. So it's at this point, but in this part of this mandate is that all medications are offered to individuals if clinically indicated. So all medications will be offered. However, we are very thoughtful and our doctors will be very thoughtful about location and, discharge. We always say as a social worker, termination and discharge starts day one. So we always have to be thoughtful and mindful about where they are returning when they re-enter into the community. And so I know that this is going to come into play when the doctor is making these decisions. But right now, we have a wait list in our county, and we've experienced quite significant delays. And if methadone is different than Suboxone because it is not just about the medication. It's a program you actually physically have to go to the clinic to receive the methadone for quite some time. Sometimes after a while of being a part of the program, you will be able to take some home, but it is very laborious. And so if you have to travel an hour or two away, this could be your whole entire day. So they're just going to be very thoughtful about how they prescribe and who they prescribe this to, but all medications will be offered as part of this program.
Well, thank you, Juanita. Here's the question for Jessica. How much of your past involvement with law enforcement and addiction do you share with folks on your calls? And Jessica, there you go.
So just to clarify, when you say calls, like the calls that we go out to, that we respond to, with the clients we work with?
Yeah.
So, peer services are an evidence-based practice. They work because there's a shared lived experience there. But self-disclosure is something that should be utilized for the benefit of the client. So it's really case by case. If sharing my experience helps empathize with what that person is going through and helps to kind of move them to a different point in their decision or in their journey, or, assist them in any way, then I'm an open book. I've done a lot of things in my life, and I've been through a lot of hardships and struggles and overcame those. And, I will share anything with anyone who asks. But if it's not something that's going to help that person at that time, then, I won't utilize it, because it's really about what the client needs.
Yes. Thank you. Thank you. All right. Here are two questions again that are much connected. Ilana asks, Juan, I know a lot of the people who are here right now. We've always been your fans. Are you winning people over through this effort who didn't already necessarily support you? And then the second question from Carol is, have you seen a change in attitude about some substance use disorder in the corrections officers and police officers in Ulster County as a result of O.R.A.C.L.E.?
So the first part is, oh my God, yes. There's no politics when it comes to this epidemic. I've had folks on the opposite side of the aisle in the legislature who have come to me with their private stories and thank me for what we are doing in O.R.A.C.L.E. And it's not, I don't take the credit. I give the credit to the folks that you're talking to here. Not all of them are here, mind you. It's a bigger team than you think. There's about 8 of us, including Saugerties PD, KPD. But I've had folks who never knew me or didn't think much of the program and said that people make their own choices. And there's a certain truth to that, but not when it comes to this. This epidemic it's a disease. And that's, if you think about it that way, if you're a diabetic, and we all heard the stories, and you get insulin. Now, this is no different. I just heard something today that was really disturbing from the Veterans Administration. The biggest issuer of oxycodone in the country was the VA. And then the VA had to shut everybody off because they found out, oh, you know what? Opioids are bad. And most of the veterans that were shut off went into getting heroin and even, and fentanyl. So this is something that affects everyone and every race and politics. To me, it doesn't play any role. And I found that a lot of folks agree with what we're doing here and that it's universal. And that's, to me, fascinating about humanity, that we understand that what we've been doing wasn't working and we had to do something different and fast. The second part about corrections and the change of behavior, sure, it was a challenge, but I see the stories now. Some people say, why law enforcement? Why are we doing this? Well, we're the first ones there. We're the ones that show up when there's overdoses, when there's a fatal overdose. You know, there was one fatal overdose that the team actually did a fund me page because the folks couldn't afford to bury somebody. I mean, this is what we're doing now. And that trust that needs to be built between law enforcement and the community you serve is extremely important. And this is one major way of doing that. But yes, there was pushback within corrections because you're literally giving someone a drug in the facility that's never happened before. And it's still not easy in certain aspects. Juanita's laughing, but and I'm sure Vince, you're laughing too. But it is a challenge. But we've had so much help along the way. Monroe County, I've taken a field trip up there. Albany County, even the state of New Hampshire, Rockingham County, they have a methadone clinic in the jail, and I saw what they went through. And so, yes, the only way to change that behavior and attitude is by showing people how this is actually helping people. And that's really what this is about. Someone said this earlier, we're here to save lives. And Julianah, you're right. We're here to save lives.
And I could just expand on the law enforcement side of that a little bit, and that the sheriff is right. You know, we have representatives from the town of Shandaken Police and the town of O.R.A.C.L.E. Police and the town of Woodstock Police, the town of Saugerties Police, the town of Lloyd Police, the town of New Paltz Police that have come to and worked with the other O.R.A.C.L.E. members, you know, not on a daily basis, but they come down, they learn what we're doing, they get an idea, and then they are calling us when they are responding to an overdose call, or they're encountering someone that they know needs help and they're just struggling on finding the resources. So that has expanded immensely over the last couple months. And the sheriff and I just did a presentation for the town of Olive and the town of Olive Town Board, and they immediately that night made a decision that, hey, I think we're gonna assign an officer to you guys, you know, 1 day a week or 2 days a week or 1 day a month. But they decided right there on the spot that they were gonna give us a resource from their agency. And we find more and more that we are being called from other law enforcement agencies. The sheriff said before, we have went outside of the county and we've helped neighboring counties with one happened to be a county employee, but nonetheless, we went and we helped. And we're in talks now with training some law enforcement members out in Delaware County. And it's really been a eye-opening experience to see that change of behavior within law enforcement. Like I said before, 5 years ago, I never thought I'd be working side by side with a social worker. And I think it's probably one of the best things I've ever done in my career so far.
And I talk about this program, not just here in the state of New York and the other sheriffs, but I went out, I'm a member of the Drug Enforcement Committee for the National Sheriff's Association. And I went to Phoenix and I had an opportunity to talk to people. And I had some feedback on how, you know, they can use this nationally. So, you know, everybody realizes in law enforcement that what we've been doing isn't working. And so this is a new route of changing that behavior, and at the same time building the trust that we need with the people that we serve.
Yeah, that's really encouraging to hear. We have one more question here, and it's almost time to wrap up. Maggie asks, and this is I think a question maybe that's on the mind of a lot of us, are there discussions about institutionalizing the O.R.A.C.L.E. program with county funding to supplant the grant funding that will expire? You got a great $900,000 grant. Then what?
And that's a great question. And thank you, Maggie. You're right. This is something that needs to be permanent, not just at the sheriff's office, but every law enforcement entity in the state. I am going to do what I can to make sure that happens here. I am going to reach out to folks like you to make sure that happens. I mean, we'll apply for another grant because grants are great. But if that doesn't happen, I'm going to depend on the folks that are on this call to help me convince the legislature and the people that this is such an important program. And we've already used this as a framework for AVERT, which is the Anti-Violence Enforcement Response Team that's targeting, our youth and violence. We know who these kids are because of the social media platforms. All they do is switch different platforms, but everybody knows who they are. But we have no cases on them. Instead of waiting for them to do something, why are we going and talking to them to change their minds before they commit a crime? And so this is a framework for a lot of other things within law enforcement. And I intend to go to the legislature, go to the county executive, and keep what we have going here and show the success, because you have to show success that this works. But I can't do it alone. I'm going to need the help of the folks that are on this call and many, many others.
Right. Juan, I'm going to wrap this up by asking a question I have, because I was doing a little bit of digging in Hudson Valley 1, and 2 years ago, there you go, I'm quoting it from 2 years ago. You said about the program, I'm going to be straight with you. I have my reservations about Oracle, but what we're doing isn't working. We have to try a new approach. So how do you now look at those reservations that you had 2 years ago?
I no longer have those reservations. It's difficult for somebody like me that's been in law enforcement for 3 decades. And the majority of my work have been the business side of narcotics, the cartels. New York City was the biggest user city, and most of my career was down there. And to turn around and change that behavior, that idea that what we were doing, it's changing for me too. And it's because of the people on this team. It's because of people like Juanita Hotchkiss and Julianah and Jessica. God bless you, Jessica. I think you're amazing. And Chad Storey, and the stories that you hear from the people themselves, those connecting stories that you hear, and those human stories that you hear. Because I believe in the human spirit. I'm a positive-minded person, but I also know that I'm not always right, and sometimes I need to learn from people. Not everything that we just like anybody else. Nobody likes change. Well, we need to change, and I'm really happy that this program is on the way. I can't wait to see what happens next year with it, because every year there's something new and different that comes out of it, and it's because of the work of the team.
I have to, Sheriff Figueroa, I will say that one of the most encouraging things I've heard tonight is how just a minute or two ago, how your work is changing the minds or addressing the reservations of other law enforcement officials in different counties, different towns, because that's significant change. And I hope it continues.
Thank you.
Folks, I think we can get you out of here at the time we said we would. So can everybody get yourselves off mute and give a good hand for our Oracle team here? I can see lots of appreciation in our chat.
In the meantime, I want to thank you for having me, and I want to thank everybody for coming out tonight. And I hope we got to most of your questions. If not, we can definitely follow up. I will get back to you, and I hope I answered your questions. And I want to thank all of you for having us here tonight. And I want to thank the Oracle team and all the hard work. And Juanita, thank you. And Indivisible, thank you for having us.
I think we had one unanswered question, Juan. We'll make sure you get it.
Right. So thank you to the team.
Thank you.
Thanks again.
Thank you, guys. Thank you.
Great.
Get a break.
Thanks, Juan.
Take a break.
Inspiring.
Thank
Thank you all,
Juan.
folks.
Thank you, Juan.
Thank you.
Thank you. Thank you for your work.
Thank you.